Reduce knee pain or arthritis with these 4 simple yet effective ways. That is what we're going to talk about today. So, one of the biggest things that I go into is your pain really coming from arthritis? And a lot of times we find that that's not the case. So, what we're going to really be learning today is your knee arthritis really coming? Is that really where your knee pain's coming from? 4 sources of pain that mimic knee pain arthritis, how to reduce your knee pain arthritis, and shockwave treatment in treating knee pain or knee pain arthritis. So these are the 4 categories that we're really going to be talking about today. So is your knee pain really coming from arthritis? I always say where the side the pain is often not where the source of the problem is coming from. And oftentimes when you go and see a medical professional and you have knee pain, the only thing they look at is your knee. They only want to take a picture of their knee. They don't want to look at the whole big, like different sources that it possibly could be coming from. And oftentimes when you go to the doctor when people complain about, it doesn't matter what body part they're hurting, they're not really sure what they did. It's not, when people come into our office, 80% of the people are like, I'm not sure what I did. I just started hurting one day. And when that happens, it takes a lot more investigation to figure out what's going on. And so going and seeing a doctor and spending 10 minutes with them and them taking a picture of you isn't going to really cut it. And when we get older, what happens is we get more wear and tear on our body. And it doesn't mean that that's going to create pain. I mean, if you go and you look at MRIs, I preach this all the time. You take, 100 people with no pain whatsoever, 60 to 80% of them are going to show something. And that happens as we get older. That's when that number starts increasing because we get more wear and tear on our body. Just like as we get older, we get more wrinkles on our face. And that's just what happens as we get older. So we need to make sure, that is that really what's going on? Does it really match with, a really good subjective and objective measures that we're going with, that we're talking with patients about? And so these are things that we have to take into consideration. So just because your image shows something doesn't mean that that's where your problem is coming from. There's so many different sources of pains that can mimic an arthritis, and we're going to be talking about more of those things. So really it's getting to someone that's going to spend time with you, and that's what you're looking for. Is the more time people can spend with you, the more likely that they're going to be able to figure things out. So 4 conditions that really mimic knee arthritis. So one is you can get a lot of muscle tightness that is around the joint. And when that happens, it feels very arthritic, but it could just be that it's just muscle tightness that is evolving like around the knee joint. And sometimes when we have this tightness, your tissues can become more degenerative or scarred down, or they may have some adhesions, or you may get some calcifications and things like that from it just being like overworked. And that tightness can create a lot of pain in the knee. But there's things that you can do to help with some of that tightness. We'll talk about that here in a second. Derangement, knee joint tightness. So a derangement means things can get kind of, joint material just gets displaced. Now you can have a meniscal tear, and that can be considered a derangement where that needs to get fixed. But there's other things that can create derangements that are not a meniscal tear, that can mimic a meniscal tear, but then also can mimic needing to have a total knee replacement. And we're going to talk about some of the research on that. So you can get these in the knee, in the back, and the shoulder, and the neck and the hip. We see stuff like this all the time. A lot of times in the knee, we have these fat pads that are in front of the knee. You can kind of feel them. And those sometimes when we're doing things repeatedly, kneeling, bending our knees all the time, we don't take our joints to the full range of motion in multiple directions, we can get those fat pads can kind of get stuck. That's one of the things that can get stuck that can limit that knee range of motion and mimic having knee arthritis or a meniscal tear. Tendonitis, very similar to muscle tightness around the joint. Our muscles attached to the tendons attached to the joint, and you can get some tendonitis feeling that can make you feel like there's some arthritic conditions going on in the knee. And then weakness around the joint, which then creates some of that tightness. So those are the things that we're going to talk about. So muscle tightness around the joint. you can get soft tissue that to undo some of the tissue that gets stuck. And so this is something that is important. We've got to release some of the tightness that happens, but we've also got to look into why is it tight? What kind of compensations are you doing that is making these tissues want to tighten up? What are you doing throughout the day that is overworking some of these areas that is giving us the reason why they're tightening up? If we don't understand why, you can release all the tightness and that can feel great, but it'll come back again until you get into that why. So really looking for compensation patterns that are happening. We're going to talk about some of the common ones here in a second. But that's things that we have to look into. Shockwave therapy. So we're going to talk about shockwave therapy on tissue that's become degenerative, tight, overworked, has adhesions or calcifications, scarring, those kind of things. Shockwave therapy does a fantastic job of like opening those up, like knocking some of that tissue out to bring more blood flow to that area so that it can start firing correctly and not getting kind of those sticking points kind of just go away. So we're going to talk a little bit more about what shockwave therapy can do later in this talk. So derangements, these are joint tightness. What does it feel like? So like I talked about, derangement is basically when your joints get stuck. Like there's material that makes that joint not move fully. And a lot of things can happen. You can have bursitis, fat pads, you can have degenerative changes where you get some of those degenerative tissues that just kind of get stuck in the joint and you can flush those out. These are all different things that can create joint tightness that can be fixed. So what does it feel like? So a lot of times what happens is your joint will feel stiff and you may not have full range of motion. You may not know that you have full range of motion, but if you move it and you can't bend it all the way, you can bend it all the way, but you have some pain at the end, or you can straighten it all the way, but you get some pain at the end. Or lack of range of motion. These are common things. Typically what happens is if, let's say you've been sitting for a while and your knee has been bent and then you try to straighten it, it's going to be super stiff. If you've been sitting and then you try to stand up, you may feel like you can't put weight on it, that your knee is going to give away. But as you start getting more weight and you start walking on a little bit, then it starts feeling a little bit better. You can step wrong and your knee wants to give away. These are common things that we see that can give us problems, but a lot of times these can be fixed in 2-3 visits. Like you'll notice a difference. I always tell people that, come in, let's just make sure that this wasn't a meniscal tear, that you potentially don't need a total knee replacement. We'll talk about some of the research on that here in a second, because these things can get some pretty quick resolution to where it's worth a try to see if this is what's going to help it versus going down the surgery route. And as we get older into those 40s and 50s, having a meniscal surgery for, just to clean up the knee or to fix a meniscal tear more than likely will not work. A lot of times your pain will come back because you're not getting to why it's happening. So what does the research say? So when you look at the research on a total knee replacement, they did surgery or they did research on this where they had people that were in line to have a total knee replacement. And they basically went through an evaluation and they put them into 2 different categories. They put them into the category where they have some joint tightness. We're going to stick them in the joint category where we're going to do some joint mobilizations and show them how to do some self joint mobilizations. Or we're just going to put them into, if they don't have any joint restrictions, we're going to put them into general exercise. And they basically put them into 2 different categories. And what happened was 40% of the people that were in line to have a total knee replacement had full resolution of their knee pain. No problems. 2 to 3 weeks, get back to their activities, feeling much better, well on their way to feeling back to 100% because they had a knee derangement. Now, usually knee extension mobilizations are what we do because we're always like, we're sitting, we're bending our knee, like things that we do all the time. We want to take our body into the opposite direction. But as we got older, what they found in this research was that they had to do more knee flexion mobs, and that's what actually helps them. And getting to someone that understands what we're talking about is super important. So finding someone that has McKinsey trained background is someone that's going to understand this because it was a McKinsey research study that was done. But That's what we do at our office. But this is something that really is to give you hope, like, oh, wow, if I can find someone that can do something like this, then maybe I can avoid the surgery. At least I can go and figure out if it's something that is going to be worthwhile, because spending 2, 3 weeks on something versus having a surgery to see if it's going to give you um, some improvement is huge. Like, if you're noticing that, wow, this is getting better, then you don't need to have the surgery. We need to avoid it at all costs, because the surgery doesn't mean that you're going to feel that much better if we don't get to the source of what's kind of going on. So really just thinking of this is to give you hope that, wow, there is something that we can do to at least give me a try to see if I can avoid having that toenail replacement, having the meniscal surgery. Because as we get, and again, as we get into our 40s and 50s and beyond, a lot of times those meniscal surgeries to clean up the knee, to see if we can buy some time, really don't work. The research on that is just, it's not great. Actually, people fared way better not having the research, not having the surgery. Even when they poked holes in and pretended like they did have the surgery, they did better by not doing the surgery than the people that actually had the surgery. So the less that we can have surgery and mess with our joints, the better we're going to be later on in life. So another thing that happens is tendonitis. So our muscles attach to a tendon, and the tendon attaches to the bone. And so there are key areas that produce pain in the knee that can give us that tendonitis type feeling. So one of them is the IT band, which is basically weakness in the hip extensors. And what does that mean? It's the muscles in the back. A lot of times what happens is when those hip extensors don't fire correctly, we tend to shift our weight to the outside, creating a lot of work for that IT band and those lateral hip muscles. And so there's a use that IT band for stability, and that creates pain on the outside of the knee. And so that's something that is totally fixable. Like, we just have to work on getting rid of the tightness and then working on the compensation patterns that are creating that pain. Patella tendon. This is when you have weakness in the quad and in the hips. And so this is where the quad can start overworking because maybe your hip muscles aren't firing very well. So these are some things that we have to do to improve that. We've got to, again, work on the weakness and release the tightness. Adductor. This is the inside of the knee pain. And this happens a lot when you get pain below the knee. It almost feels like you have a meniscal tear, because you'll get pain almost along the knee joint on the inside of the knee. And again, this is tightness where there's 3 muscles that attach through there, which is basically kind of the adductor muscle, part of the hamstring that's part of the adductor muscle, and then there's another part of the quad that will actually attach that inside. And so you've got to, again, release this tightness and then work on, why did it get tight? What are some of the compensation patterns that we have to do to fix? So generalized weakness around the joint. These are some of the things that we see, when most of the time it's weakness in the hips that can create a lot of knee pain. And so when you see your knee kind of coming in, where it's knock kneed is kind of what I say, similar to what this picture looks like. If the pain is on the outside of the knee, if you have that knock kneed looking, where your knee moves in, then that means the hip rotators are a problem. So that those hip rotators actually keep that knee in a really good alignment. So that's what you have to start working on. So if you see that when you do a single leg squat, that your knee comes to the inside, there is a lot of hip rotation weakness that we have to address. If the pain is on the outside of the knee, that means that you're shifting your weight more to the outside of the more of the outside of your body, because you can't get those hip extensors to fire correctly. So you're using a lot of the hip muscles on the outside. That gets overworked, and that will typically produce pain on the outside of the knee. So pain location, and I always ask people, like, where's your pain located in the knee? Starts giving us indications of what's going on and where some of your compensation patterns are. If the pain is on the inside of the knee, these are usually your adductors are the problem. So you can have a lot of weakness in your adductors, but you can also have weakness in your abductors. So the muscles on the inside of the leg and the muscles on the outside of the leg. And you're getting a lot of compensation there. So these are some of the generalized weakness patterns that we see that need to be addressed when you have knee issues. So shockwave therapy, what is this? Shockwave therapy is regenerative, non-invasive treatment, and it uses shockwaves. So think of like a jackhammer disrupting the tissues below the skin, similar to like it's disrupting when it's jackhammering cement, it's disrupting everything underneath it to kind of break everything up. Very similar. So you're going to be able to get rid of calcifications in the tissues, scarring, lack of blood flow, calcifications, adhesions. Those kind of things are things that it can kind of help. It knocks those things out, increasing blood flow in that area significantly speeds up the healing for anything that's been chronic or that is recent, something that just happened, like literally has just happened. We can speed up the healing for that. It promotes new collagen production, which is a key in connective tissue healing. So what does it help with? It will help with those tissues that are really stuck around the knee so that you can actually get good muscle strength. You can actually go through the muscle as you're working it to allow it to start to fire correctly. And where a lot of times what happens is when it hits those areas that have scarring or degenerative changes, when it hits that area, you'll start getting that pain. And that's what it'll start taking away. So you can get better muscle firing through the muscle as we work on doing shockwave to it. Other things that it can help, plantar fasciitis, Achilles tendonitis, adhesive capsulitis, recent injuries, MS, tendon muscle injuries, nerve healing, chronic issues such as in the back, neck, shoulder, knee, as well as the ankles. So there's a lot of things that it can help. If it's something that you're interested in learning about, wait to the end because you can definitely work with us to figure some of these things out. So what do you take from this? We need a multidisciplinary approach to arthritis, to knee pain. Is arthritis really your problem? And that's where if you can find a good healthcare provider who can spend time with you, that is the key. Who can spend time, who's looking at the whole body, who's not just looking at the knee to really come up with a game plan for you. It is possible to feel your best as we get older. It is possible to not have to slow down and continue to stay active as we get older. And sometimes we just need to start taking care of ourselves now and not wait till we get so bad that we can't move. Because when that happens, it just takes a lot longer, and surgery can be something that's going to have to be in your future if you wait too long for us to get some of these resolutions. So what is some other education that's coming up? We are going to be talking about Shockwave. So it's perfect. You want to learn a little bit about Shockwave and how to say goodbye to some of those chronic pains that you have. We are doing an event on May the 23rd at 6 p.m. virtually. We're going to be talking about what Shockwave is, how Shockwave can help you, how it speeds up healing with those chronic and recent injuries, and how it can help with your arthritis. And we're going to be learning a lot more. So we're going to be showing you pictures of tissues and what it looks like as we kind of get older and how we can improve those tissues with shockwave therapy. So if you're interested, make sure that you look in the comment section down below so that you can there'll be a sign up link for that event. So other resources, if you're wanting to work with us because you're like, yes, I get all this. I want you to figure me out so that I can get help as quickly as possible. Then go to our website, www.empower-pt.com, and you'll find a section where you can actually click on a free discovery visit, and you can click on that, fill out some of the paperwork, some of the questions that are going to help us be able to help you a little bit better. And we can sit down and have a conversation on what's going on with you, why the things that you're doing haven't been working, and what are some of the other things that we would look at based on our conversation. You can get to our latest blogs. We have a ton of blogs that we post every month. We post at least 2 a month. And you can get that at www.empower-pt.com/blog. And again, check us out. We have a podcast. You can find us on Apple. It's called Empower Your Life. We're also on SoundCloud, as well as our YouTube channel. Make sure you subscribe to our YouTube channel as well, so that you can stay up to date with all of our content that we put out to help you figure out what's going on with your body.